we've seen a growth of voluntary benefits because in healthcare, the employer has been shifting the burden and the cost of that of healthcare onto the employees, and they're creating copays and deductibles and co-insurance. But if I'm running a company and I want to be as strategic as possible about my voluntary benefits, maybe I'm considering adding or cutting offerings. What do I need to know in that context?
The voluntary benefit world was really established to help people pay for additional services that medical insurance wasn't paying for. When we look, some people say, oh, you use it to cover your medical expenses. And sure, some people do, but math tells us that less than 20% of the money that people receive from having these additional services ever see a doctor. We don't lean on medical insurance anymore like we used to, because in the past 10 years, medical insurance, anyone who used it realized it's too expensive to use. So we pulled some numbers this morning, and it said in 2012, 54% of people got medical insurance through work. And now we have 52% of people get medical insurance through work. So let's call it roughly a little more than half of our population. When I look at voluntary benefits, where in 2014 to 2024, accident coverage has had 188% growth. CI, critical care, heart attack, stroke coverage, 150% growth. And hospital, 213% growth. So when you look at where it fits, where it used to be something nice to add on to for someone to feel like if they wanted additional coverage, they could get it. Now people use it for a whole host of reasons, including a primary one, to attract and retain talent. Because if you are a certain level and above of talent and you're being pursued by a company, those medical benefits matter to you. And the entire benefit package now matters.
We talk about that too. We talk about the Alice demographic, right? The asset limited, income constrained, yet employed. And I like the way you nerded out with the 54 and 52%. But we all have to remember that the population of the United States has grown, right? So those are bigger numbers of people that only half of those numbers only have health care. And it really begs the question, how much can they afford of that health care? Which is why I think you need to augment those programs.